My name is Don Baker. I'm a business marketing manager for Philips Healthcare. I also was a advanced application specialist for Philips, specializing in prostate imaging, and I'm actually an MRI technologist as well. Thank you for having me at the 7th Global Summit for Precision Diagnosis of Prostate Cancer. I want to share with you a little bit today about what Philips is doing to really aid in prostate cancer detection and treatment as a corporation. We offer a really broad portfolio of prostate solutions. I'm going to give you a little bit of an introduction, talk about our prostate portfolio, early detection, definitive diagnosis, and also some of our options for MR-guided therapy. Obviously, we're seeing that prostate cancer detection is becoming more prevalent. It's really the mammography in men, which I think correlates well with this society. Prostate exams are increasing. We obviously need better options to target lesions for biopsy and treat those as well. So early detection, I believe, is key. Definitive diagnosis is very important. We want to make sure that we know what we're dealing with and where that area is, and then also having MR-guided treatments to guide towards correcting that. Now, Philips offers a broad portfolio. We have very smart workflows on our MR systems. We have new systems that are technically helium-free operations, lightweight, no vent pipe, systems that can be placed easily within your institution. We have what's called Smart Speed for AI-based reconstruction, and also QP Prostate. The MR7000 is our elite 3T system with a 65-220 gradient. We actually offer Dynacad, that is a Philips product, as well as Euronav. We work with Tulsa Pro. We have our own MRRT, and in conjunction with Electa, we have an MR Linac. As far as imaging goes, we have a broad portfolio. I'm not going to talk about all these right here because I will talk about a lot of them as we move through the presentation, but you can see that we have a lot of things that are geared towards prostate imaging. So as far as early detection goes, really on our newer systems, having less than 1 minute setup, lighter coils, and faster changeover times, we feel like is very important for prostate imaging. Improving productivity is very important. The ability to reduce scan time is important. Compressed sense and AI reconstruction really help to reduce scan time to a much more reasonable level, and prostate imaging tends to be one of the longer exams that can be done on an MR system. So you can see here, if we actually use the what we call Smart Speed AI-based reconstruction in conjunction with compressed sense, you can get extremely fast scan times with the AI-based reconstruction in your standard imaging, and using compressed sense to denoise your diffusion-based imaging. Obviously, you want to have increased patient accessibility. Sometimes you get larger patients that are more of a belly breather. Motion can be a big problem, especially in the sagittal scans, which can degrade your sagittal image quality. We actually have solutions with Smart Speed to help to fix that. Traditionally in the past, we would use a multi-vein technique. It had a circular field of view, which a lot of physicians didn't appreciate. The other problem was the image contrast was typically not the same as what you would see on your axial and coronal or axial and coronal Cartesian scans. So with Smart Speed motion free, you get a square field of view, and you actually get that image contrast that you're used to with your standard imaging. Confidence and robustness when you have hip implants is important. We offer what's called DWI XD TSE. This is compatible with compressed sense, also with Smart Speed. So you can see here faster scan time versus your EPI-based diffusion, and really no distortion, despite the fact that this patient has a total hip replacement. We partnered with Equibum. This is on our Health Suite marketplace. You can do this on console, on a console back in the reading room, I should say. The QP Prostate tool really offers fundamental change in prostate analysis and helps radiologists improve their workflow and decision making. It's AI-based detection of prostate anatomy, for identification and PI-RAD segmentation of each prostate region. It's automated volume measurement and sector mapping. It also has automatically segments and ROIs the MR images for biopsy and focal therapy planning. And it gives you a PI-RADS compliant report. This is just an example of the actual workflow. Then we want to help physicians make definitive diagnosis. Having higher resolution, higher signal to noise, better image quality is very important, but also reducing scan time and increasing throughput. You can see here, this is a PI-RADS compliant protocol using SmartSpeed, and you see your 3 plane T2s, really with reasonable scan times, around 3 minutes, and then also getting your compressed sense denoised axial B1000 in about less than 3 minutes. And then you can see here, this is another case, axial T2 with SmartSpeed. It's over a minute faster with better resolution, so you can get higher resolution and be able to denoise that image and get comparable image quality but with more detail. So one advantage of SmartSpeed that's unique in the industry is the ability to use that with quantitative imaging, which is in a lot of the other vendors you're not seeing that currently, because the fact that you apply the AI-based imaging, you're actually seeing some deviation of your values. But we're actually able to apply SmartSpeed AI with, say, things like T2 mapping and actually get accurate values that compare to the other, a standard T2 mapping sequence without any deviation, but with better image quality. And having speed also has the advantage of maybe being able to add something in. You can see in 30 minutes they were able to acquire several standard images and also do what's called DWIBS, which gives you sort of a PET-like image, a diffusion-weighted imaging with background suppression, whole body, to find maybe places where this patient has high risk of metastatic disease, where those mets may have gone to. Another really unique thing is what's called 4D free breathing. This can give you very high temporal resolution, 7 seconds per dynamic, very good resolution, and this is motion free, so motion robust, and you're able to put this into your analysis tools without any issue. If you want to do EPI based imaging but your patient shows up really unprepped, a lot of times that's just a call to reschedule and get them prepped properly, but using things like iris diffusion, which is a phase correction built in. It's an interleave multi-shot EPI diffusion scan, slightly longer than a standard diffusion scan, but at the same time, maybe you're not rescheduling this patient because of the distortion that would be caused by the air in the rectum. Many of you are probably familiar with Dynacat Prostate. This really gives you automated 3D gland segmentation, your PI-RADS reports, single-click analysis, fusion targets, and this is compatible with UroNav. So really getting your multi-parametric analysis with kinetics, MPR and MIP, automatic segmentation, and a customized report. And UroNav really is, I think, the way to do biopsy. You're really targeting the lesion instead of doing a truss-type biopsy, and that is compatible with the Dynacat Prostate as well. So really getting right to the lesion without risk of missing that lesion and getting a maybe not as good of a diagnosis. Now, if you do detect cancer, obviously being able to treat is important. We offer several options for MR-guided therapy. We have what's called MRCAT Prostate. This is using our MRRT system. It generates a synthetic CT image that you can use for dose calculation. You do not need to do a CT scan. It allows you to do accurate dose planning and a fast, consistent imaging protocol. We find very little deviation, so the dose calculation using the synthetic Hounsfield units is accurate, and delineation is just much easier on MR. You're probably not going to get reimbursed for that CT scan if you do it, or for the MR scan if you do that. So being able to just do one is much better for the patient, and it's much better for the facility. And then lastly, MR-guided therapy using Profound. I know this is on multiple vendors, but this is something that Philips is working very closely with Profound for the TULSA-PRO type technique. The advantage of that is that, again, it's not really non-invasive to some degree. It's customizable, it's predictable, you don't have that incision that's needed, and there's no radiation involved. So there's some big advantages there, and again, we're working very closely with them, and this is something that is compatible on Philips MR. And I'd like to thank you for your time. I hope everyone enjoys the rest of the meeting, and I'm looking forward to speaking with you if you have any questions.